With glowing hearts we sing, fire from far of your calling. God in heaven, I sing. We say your hearts calling. With glowing hearts for thee.
Thank you, Lion. Thank you, Dr. Agape. Now I would like to ask the Lion, Dr. Mithila for land acknowledgement.
Thank you, Dr. Shafi. Acknowledging land. I acknowledge the land on which I currently work, live, and play. For thousands of years, it has been the traditional land of the Huron-Wendat, the Seneca, and most recently the Mississauga of the Credit. Today, this meeting place is still the home to many indigenous people from across Turtle Island, and I'm grateful to have opportunity to live and work on this land. I want to recognize and honor the spirit of the missing and murdered and indigenous women. By saying that, I would like to introduce Dr. Shafi. We all know him. Still, welcome everyone to our 8th Diabetes Awareness Session. It's my honor and privilege to introduce Dr. Shafi Bhuya, the founder and charter president of Toronto Global Doctors Lions Club. Dr. Shafi is also our past region chair and current district diabetes chair, campus chair, and youth exchange chair. He is an active lion for over 3 decades now. For his outstanding contribution towards our community, he has received many international awards, such as International President Distinguished Leadership Award, Melvin Jones Fellow, Helen Keller Fellow, and a Harry Newman Diabetes Award. Dr. Shafi has been leading this webinar series on diabetes awareness session, which has created a real impact on understanding the disease and its management better, that has given us the way to live a healthier life. The key focus is to help participants to build an active lifestyle and healthy food habits to self-managing the disease. Also, the best practice of prevention and control diabetes. I'm sure you all will agree with me that Dr. Shafi is extremely passionate about building community health by connecting people from different walks of life. He is also a visionary and an accomplished lion. He is a well-deserved candidate for the position of second vice district governor in our upcoming election. I solicit all your active support and best wishes to Dr. Shafi. Now I heartily welcome Dr. Shafi to oblige us a few words of your inspiration. Dear Lions, please put up your hands together for Dr. Shafi. Thank you so much.
Thank you, Mithila, for your excellent introduction and kind words. I would like to welcome our 8th iteration in this kind. Usually we have a 80, 90, 100 participants. Today, simultaneously several meetings going on. That's why I would like to request our PDG, Lion Eka, to say all introductory remark first before I go to next. Lion PDG, Governor Eka, please. Opening remarks.
I'm so happy to be here now, see my friend, Dr. Shabi. And then I think we could have very interesting evening again today, and we can learn more things, what he's going to do when he's going to be our governor. And then I also think he's going to be our long time first council chair from A711. And then my future is that he's going to be one day with our international president. I have been done so many things and I'm so pleased. And thank you again. And then let's continue. Thank you very much.
Thank you, Governor. Your kind word and inspiration. It means a lot to me and my team. We continuously working hard, and we will do our best to make our Lionism better because we have that expertise. Our team is ready to serve. And I would like to now introduce our neighboring district governor A for Leon Jane. Leon Jane, you would like to say anything? Welcome before we start.
Yes, I want to thank you for inviting me to this. As I told Dr. Shafi, I will be the next year's MDA diabetes chair. So I'm here to learn. I am diabetic, so I do know a bit about it, but you always have to learn something every day. So I'm here to learn and to participate with everyone here. And together, we will get rid of that diabetes one day. Thank you.
Thank you. And welcome our friends, our leaders, district leaders, Leon Marlin, our counterpart, diabetes chair A4, my friend Leon Mel, and our colleagues, Leon Maria, and all, and Leon Munni. So without further delay, I would like to start today to introduce you key elements of diabetes. 1 in 3 Canadian are in a situation to be diabetic. So patients with diabetes use healthcare services 2 or 3 times higher than the normal population. And it costs our hospital occupancy and money about 17 to 20 billion dollar per year. Can you imagine? And diabetes type 2 can be preventable, can be aborted, and it increase the issue of mobility and morbidity in this country. And diabetes data shows is increasing from 9.3% to 12.1% by 2025. So type 2 diabetes is preventable. Over 50% people will pre-diabetic, and condition that leads to diabetes for most people who have it. The onset of diabetes can be delayed or prevented using proven approaches. My friends and colleagues, today we have a bunch of colleagues who we are talking about the prevention and how you live your life longer. As you know, many Canadians with pre-diabetes are not even aware of this risk, although the Canada does have many diabetes preventive services like weight loss program, gym, nutrition, but none of them is incorporated with the diabetes promotion program. It's all scattered and fragmented. Identify diabetes is one of the objectives, but to identify, you need to aware people, to inform people, to educate people, and to assist people how they change their lifestyle, support them to maintain their lowest risk. And we Canadians are far behind in Australia and Finland. That's why we need to learn together how we can make our life better and disciplined. I would like to ask Mithila, Dr. Agafaya, to introduce our first speaker from our panel today. Agafaya, please.
Thank you so much, Dr. Shafi. I'm pleased to introduce Dr. Iman Radvan. Dr. Iman Radvan is a pathologist who completed her training in pathology at the Medical Research Institute, Alexandria University, Egypt. She got a master's degree in pathology and has over 4 years of experience as a research and teaching assistant at the Pathology Department, Medical Research Institute, Egypt. Dr. Radvan is interested in immunotherapy research and applying this type of therapy in different diseases, especially breast and lung cancer. So Dr. Iman, the floor is yours.
Thank you so much, Agafia, for the nice introduction. I'm going to share my screen. Thank you so much, Dr. Shafi, for giving me this great opportunity tonight. Good evening, everyone. Today, you know that our topic is living longer with diabetes, and I and my colleagues are going to share with you some important hints regarding living longer with diabetes. Let me first of all share with you some facts and numbers in Canada. The number of cases with type 1 and type 2 diagnosed diabetes in Canada is 3,772,000 in 2020, and this number is predicted to reach...
Hello?
Hello?
Go ahead.
Oh, sorry. And this number is predicted to reach 4,891,000 by 2030. And this means that the increase in number of type 1 and type 2 diagnosed diabetes will be 30% from 2020 to 2030. That's why this topic is very important in Canada. And as Canadians, we have to learn about diabetes, whether we are diabetics or not, whether we are healthcare providers or not. Also, the direct cost to healthcare system was in 2020 was 3.8 billion, and it is expected to increase to 4.9 billion by 2030. So, in order to live longer with diabetes, we have to have like a very strong programs for screening, prevention, and treatment. Are we able to do any of this without against the patient's will, for example, or without convincing the patient that he has to go for screening, he has to go for prevention, or he has to adhere to treatment? Absolutely not. We have to convince the patient. That's why diabetes empowerment is a very important topic. What is diabetes empowerment? Diabetes empowerment means that we need to empower our patients, diabetic patients. What is the definition of empowerment in general, patient empowerment in general? It is a process. In this process, patient will have the knowledge and self-awareness that will allow them to influence his own behavior, and not only his own behavior, also the behavior of others, to improve the quality of their lives. And the aim of patient empowerment is to give the patient the critical thinking required to make informed decisions regarding their healthy lives. So what will be the outcome of patient empowerment? Is it patient empowerment and that's it? No. Patient empowerment will be reflected on the healthcare provider. It will be reflected on the healthcare professional. And he will have the ability to discuss more with the patient and give him more time and give him more care. That's why empowerment is very important. In diabetes, there are three main pillars of empowerment in diabetes, and they are the belief that, first of all, diabetes is a patient-managed disease. Diabetes is totally different from any other disease, especially acute diseases. It will not be only managed by the healthcare provider. It needs to be managed by the patient himself. Second, the belief that the type of care that we are going to give to the patient is education and knowledge. Patient has the right to receive the appropriate knowledge and education to make informed decisions regarding their lives. And thirdly, the belief that patients should identify and implement their own treatment goals. He should identify the goal that he want to reach, like preventing cardiovascular complication, like preventing retinal detachment. So these are the three main pillars of empowerment. Now we understand the definition of empowerment and the main pillars of empowerment. We need now to understand the process of empowerment itself. There are 5 steps in the process of empowerment. The first 2 steps start with when the healthcare provider sits with the patient and start to identify the problem. He starts to define this type of disease. He starts to define what is diabetes. And then he will listen from the patient what is his beliefs or thoughts in order to understand if this patient is going to support his effort or not. The third step is to identify the long-term goal to where the patient would work. For example, the long-term goal of this patient would be preventing cardiovascular complications or preventing retinal detachment, preventing kidney disease. This is the long-term goal of the patient. Then the fourth step will enable the patient to identify a behavioral change that he will stick to in order to reach his goal. For example, for preventing cardiovascular complication, he will do a behavioral change regarding his diet. For example, he will follow a diet with low cholesterol, for example. So this is the behavior change that he would be responsible for. And the final step is for the patient to evaluate his effort and to identify what he learned in the process. So now we can understand that empowerment is not only a strategy or a technique for treatment. No, empowerment is a vision that helps people to have their own informed decisions. And also the potential of empowerment is not only regarding one individual. It will not only help one individual to make their own decision, it will help the whole community, because when one patient is empowered, he will reflect all the empowerment to his friends, family members, and so on. So now as normal people in the society, we are not healthcare providers. We are normal people in the society. Do can we do any role in the empowerment? Now we understand that empowerment mainly comes from the healthcare provider, but as normal people, we have to do a role, to play a role, even if it's a small role in our society. We can play this role by doing education and conveying authentic information. We have to know like a very basic information regarding diabetes, and then we can share this information with our friends. We can share this information with our family members, because by this way they will know that diabetes is a preventable disease or it's a treatable disease, and we can prevent all the complications, and thus they will be empowered and empowering all people surrounding them, and they will be able to discuss more with their healthcare providers. So now let's learn about some important information or some important tips. First of all, most of the patients, when they receive first diagnosis, they freak out and they say, no, it's not my diagnosis. I will go to repeat the test. No, it's not a mistake, and it's true. And we have to behave accordingly. And now we have to search for what are the routine that we should adhere to. So first of all, it's not a mistake, and we should behave according to this diagnosis. And secondly, we should not freak out, because this is not the known historic diabetes. This is not the diabetes of our grandmothers. Now, with all the modern medicine and all the treatments available, we can prevent all the terrible outcomes such as blindness, amputations, and kidney problems. Now they can be not visible even because of the all modern medicine. So also, we should know that type 2 diabetes in a specific, or diabetes in general, it's not anyone's fault. Please do not blame yourself. It is related to some genes. It is related to family history. It has a strong correlation with family history. So do not blame yourself, and just try to react to the diagnosis and behave according to this diagnosis. And then knowing the numbers is very important. People should know their numbers, their A1C level, their blood pressure, lipid profile, because by knowing this number, we can prevent many, many complications. Also, there is a rumor that's saying that diabetics are limited to eating breadseed, nuts, and they are prevented from eating many, many types of food. This is rumor. This is not true. Diabetics are allowed to eat many types of food, but not frequently and in smaller portions. And if we think here, we can find that everyone in the world, if he follows like a very good diet and a healthy diet, he will have a healthy life. So not only diabetics are the ones that we should tell them, no, you should not eat this and that. All of us, we should follow a healthy diet. And unfortunately, some diabetics say that I do not wanna adhere to this type of medications. Medications have side effects, and I do not take many medications. But here, we should think of the advantages and the disadvantages. So medications are very important to treat diabetes and prevent all the long-term complications of diabetes. So we cannot say that. We should encourage our family members, we should encourage our friends that medications for diabetes are very important, and they will help you to live longer with diabetes. Also, protecting the cardiovascular system is essential. Why it is essential? Because it is the main reason behind living longer with diabetes. Taking care of your heart. Taking care of your heart is very important. And how should I take care of my heart? By stopping smoking or avoiding smoking, by taking care of my blood pressure and my lipid profile, as I said before, A1C level, and having a healthy lifestyle such as exercising. Again, healthy lifestyle is very important, and this does not mean that we should reduce our weights. No, this is not the idea. The idea is that we should have a healthy lifestyle. We should eat plenty of vegetables, plenty of fruits. We should have a fixed workout on a daily basis. That's how we could achieve a healthy lifestyle, and at the same time, we will reduce our weights, and accordingly, we will prevent diabetes or even live longer with diabetes. And At the end, do not do diabetes alone. We should encourage our friends and family members that have someone who is very close to you, someone who supports you all the time, because diabetes is something that is overwhelming, right? Because the patient, when he takes care of himself, he will concentrate on what to eat, what not to eat. He will concentrate on having a daily workout. He will concentrate on his medications. He has to concentrate on many things. That's why diabetes should not be done alone. We should have someone who we trust, or even this one could be our healthcare provider, because if we follow the empowerment and if we become we trusted our healthcare provider, this one who could be our healthcare provider, we should discuss everything with him and trust him a lot. So now we understand the concept of empowerment. We understand what very basic information that could we share with our friends and family members that could prevent them from diabetes or encourage them to have treatment for diabetes and prevent the long-term complications of diabetes. So, those are my references, and I hope that you enjoyed the presentation. Thank you so much for your attention. And if you have any questions, please reach out to me. Thank you.
Thank you. Thank you so much. Thank you so much for a very informative, very impressive presentation. So we can see our Dr. Kai Men, Dr. Kai Min Ken, Governor is here, and our other lounge leader is here. So let me ask you, if you have any burning question, you can ask now, or you can on hold. After 3 presentation, we can discuss. Is there anybody?
We have raised a hand by Asad.
Who? Asad?
Mm-hmm.
Okay, Asad, Dr. Asad, go ahead.
So my question to Iman is, as he said, eat more vegetables. So does that mean the vegetarians have less affinity to get diabetes?
No, because diabetes is not related to eating meat or something. So eat more vegetables. It means that you should eat something like not high cholesterol food, because vegetarians are not only they are not avoiding only red meat. They are avoiding chicken and something like that, and chicken do not have like high cholesterol. So no, it's not related to that.
Thank you.
Okay, good. So if I'm not hearing none, so maybe you can hold your question. And because we have a 3 presenter, we can go forward for the next. I would like to Mithila to introduce our 2nd presenter.
Yeah.
Give applause to Iman. Wonderful.
Thank you, Iman, for your very informative presentation. So yeah, our next presenter, Dr. Yasmin Shalabi. She is an internationally trained dentist, and she has more than 5 years of experience in clinic management, insurance, and administrative work. Upon coming to Canada, she became a certified Ontario medical, legal, and community interpreter, where she helped refugee newcomers and immigrants with their new life and the daily challenges they face. She demonstrated respect for person and impartiality, a high degree of confidentiality and professionalism. Dr. Shalabi pursued the bridging program for internationally trained medical doctors at Ryerson University as a part of her continuous professional growth. She has a passion for research and global health studies and worked on projects focusing on maternal and child health. She is a member of Canadian Coalition for Global Health Research, where she shares a particular interest in knowledge translation and policymaking. Dr. Shalabi always looks for opportunities to give back and uses her skill and her medical background to contribute to team success. Dr. Shalabi, we are very pleased to have you here with us tonight. You can start your presentation now. Thank you.
Thank you so much, Mithila. Thank you. If I may share my screen.
Yes, all is yours.
Thank you. Well, good evening, everyone, and thank you so much, Dr. Shafi, for this wonderful opportunity. Yeah, okay. Today, I'm going to talk more about live longer with diabetes, but I'll be more specific into the intervention for prevention. What kind of interventions do we have to prevent diabetes? And we're talking particularly type 2 diabetes. Type 2 frequency increases 44% between the years 2015 to 2022, with, of course, 2 to 3 times more hospital visits. And type 2 diabetes has many factors that increases its incidence, including poverty, inequality, aging, poor nutrition, food insecurities, low education, environmental pollution, and genetic factors. There are also so many other risk factors enhance the prevalence of diabetes, example, advancing age, obesity, physical inactivity, ethnic background, and family history. Obese adults are 2 to 4 times likely to have diabetes type 2. And in 2009 to 2010, almost half of the Canadians aged 12 years and older reported they are physically inactive and that they are also eating less than 5 times a day of vegetables and fruits, which is considered unhealthy diet. With increasing rates of obesity, the risk of diabetes is expected to increase, of course. However, Canadians can reduce their individual risk by being physically active and by maintaining normal weight or at least losing the excess one. During the COVID-19 pandemic, it has clearly exposed the relation between non-communicable disease, infectious diseases, and the broader social, economic, and commercial determinants of health. People with diabetes have 2 to 3 times increased risk of COVID-19, unfortunately, compared with individuals without diabetes. And this risk is increased in conditions where there is poor glycemic control, or I would say uncontrolled diabetes, or with diabetes-related complication existing, and also with social conditions in the less privileged communities where they have lower access to care and high rates of comorbidities. Well, in the World Diabetes Day 2018 campaign, it promotes for universal health coverage, which include improving the knowledge and the capacities of people with diabetes and their families to take charge of their own care and to reduce economic hardship in households. The evidence base for improving diabetes prevention and care is strong, and the WHO is announcing the development of the WHO Global Diabetes Compact to be launched in April 2021. Through the compact, the WHO will work with partners to support countries mobilize resources in order to enable for better access to essential diabetes medicines, inclusion of diagnosis and treatment of diabetes in primary health care, reduction in major population level diabetes risk factors such as, of course, obesity, and for the universal health coverage packages. This initiative is a very valuable opportunity to build partnership between governments, care providers, patient advocates, and non-governmental organizations, which will, of course, enhance or implement recommendation through a renewed global diabetes movement. Various diabetes prevention program studies have been conducted around the world. And for the prevention of type 2 diabetes programs, they are effective in helping individuals with high risk or at risk to lose their weight and lower their blood sugar level, and of course, delay the onset of diabetes significantly. And also the American Diabetes Association recommended intervention for preventing or treating diabetes and its complications to be considered very effective, very cost effective for all which relieves the burden on all health systems. To our knowledge, there is only one national diabetes prevention program in Canada, currently funded by the Public Health Agency of Canada for less than 4,000 individuals. Diabetes Canada has lamented that Canada doesn't have a coordinated set of policies for diabetes prevention and treatment. Although Canada is rich in the prevention-related services, but there is no mechanism to package them into structured, personalized, and coherent prevention programs. Thus, further researches are required to develop models that predict good outcomes. Ironically, type 2 diabetes is preventable, and prediabetes is a condition that leads to the development of type 2 diabetes in more than 50% of the people who have it. However, its onset can be delayed, or even prevented using proved approaches. As Dr. Shafi mentioned earlier, unfortunately, Canada engagement in this program is very low and needs to be improved. Where other countries as Finland and Australia have invested in infrastructure for diabetes prevention for over a decade and have many citizen accessible programs. But luckily, we are having a promising Canadian intervention is preparing on the time being, which is the PREVENT program. It uses evidence-based guidelines to prevent diabetes and its associated complications. A team of researchers and scientists from the University of Toronto and Ryerson University are working together to create a Canadian proactive ecosystem for values, exercise, nutrition, and therapeutic, which is PREVENT, for identifying, informing, and educating, assisting, and supporting to help pre-diabetic individuals to be able to lower their risk and delay or prevent future onset of diabetes. The PREVENT team will be able to have a superior ability to gather data, analyze, and act in response to what we understand, which will assist in decision-making, make more sound and more informed decision, and support interventions and support maintenance of prevention activities, and will enable incorporation of these into virtuous cycles of learning, autonomy, and changes at the end. So we're all looking for this wonderful, promising intervention to happen one day soon. These are my references for further reading, and thank you so much. Thank you for listening. Thank you so much.
Thank you, Dr. Yasmin, for your very brief and sweet presentation. Is so many information you share, which is innovation. As you know, innovation is the highway. We moving forward to Canada, make Canada proud, not only scattered way, is an organized way. And we are proud that UFT, our scientists, colleagues, Dr. Karim and his team, and Ryerson, our team, working together to make it happen. And maybe many of you know that Ryerson University is moving to Brampton with a new medical school, which is a historical movement from the provincial government. And we are part of it. And hopefully we can get more things done to help support a diagnostic tool or to make people aware or promote the health, because Canada is a proven record of health promoter. So in our backyard, we cannot accept without doing nothing or status quo. It's a very good presentation. If anyone have any questions, I can see again, Asad, go ahead.
So my question to Dr. Yasmin is, as you said, the diabetic people, they were tested more COVID positive. So what's the reason behind it? Sorry.
No, I didn't say more COVID positive. I said that they suffer more than the rest of the people, the other people. 2 to 3 of them are actually suffers more when they get COVID-19 virus.
And you know, the COVID positive only maximum those who have immunocompromised diseases, anything they have some underlying diseases. Yeah. That's the reason COVID is mostly hitting.
And is it because like it's a research-based analogy, or just because like hyperglycemia make your lymphocytes like less functional, or is it like a research-based thing that they are tested more positive?
Actually speaking, I don't know. I would say that my point was about that they suffer more because of the because of their communicable disease. There is a relation now between them and the infectious diseases, where it increases the incidence of those people, like when they get the COVID-19, they actually suffer more. They are more liable to the complications of COVID-19 rather than the other individual who have no diabetes. That was my point in the presentation, and yeah.
Anybody would like to add anything?
Yes, Dr. Shafi, I would like to
Go ahead.
add, you know that only 60% of the people who get COVID-19 have symptoms, right? The rest are asymptomatic. So it's normally that diabetics will have symptoms, and that's why accordingly they will be tested more positive because they have symptoms because they are immune compromised. So that's normal. If they are immune compromised, they will have symptoms, and that's why they will go for the test and they will be tested positive.
Yeah, and they complicate more because of this underlying immune conditions.
Excellent. Let us give Yasmin a big clap for our excellent presentation.
Thank you.
So let's move on to another very important research-based presentation we will enjoy. So now Mithila, go for the next presenter.
Yeah. So our last presenter of today's session, Dr. Nabila. She is a medical professional and an international graduate in public health. Upon completing of ITMD bridging program from Ryerson University in April 2019, she worked as a research intern at St. Michael Hospital. She is a diligent and dedicated professional who brings a strong working knowledge of the medical environment as well as a public health lens into her work. Her research interest revolves around looking into an intersectional lens among the marginalized population and maternal health. She aims to see herself grows within the non-clinical sector here in Canada. Currently, Nabila is a graduate student of Master of Science in Community Health at Dalalana School of Public Health, where she building herself in the field of research and science. She is also an active president of a Scarborough Global Doctors Lions Club and passionately work with Diabetes Awareness Committee towards diabetes health promotion within the community. Nabila always approaches challenges with a can-do attitude and bears the ability to succeed both independently and alongside a team. Nabila, the floor is yours now. You can start. Thank you.
Thank you, Mithila, for the generous introduction. So I'll be sharing my screen now. Let me know if everybody can see well.
Yes.
All right. So thank you again for that introduction, and thank you, Dr. Lion Shafi, for giving us this opportunity. Last 8 months have been a very great journey with the Diabetes Awareness Seminar Series, and we young physicians had this privilege to share a range of topics on diabetes. And the last two presenters did a very nice job touching upon the new aspects of diabetes. Me, myself, coming from a research background, would like to switch the gear to the scientific aspect. So please stay and bear with me as I explore the evidence-based research. And yeah, feel free to stop me anytime if you have any questions or just type in the chat. Agafai will help me to regulate that. So once a person is diagnosed with diabetes, type 1 or type 2, the worry begins. How long will I live? The life expectancy starts to begin, that starts to think how long will they live? And death is never a pleasant experience, but it's human nature to know how long can I expect to live. So I'm just going to take a brief pause here and do a quick poll and see what my audience think about life expectancy for someone living with diabetes. So I'll be launching a poll and feel free. Can everybody see the poll? Okay.
Voting.
Okay. Yeah, voting, I guess, have started. So please feel free to type. And if you're not sure, you can anytime type not sure. Maybe I'll give a couple more seconds and then we can stop polling and see what people have pressed. And oh yeah, it is anatomist, so feel free to type your answers and not get judgmental. Okay, so I'll stop the polling now and share the results. Like if everybody can see, like mostly have 42% have said 10 years and less, and many are not sure. Some said not reduce at all. Absolutely. So I'll stop sharing. And yeah, so absolutely, there is no hard and fast answer to this question, how long can I expect to live? So there are a number of factors that influence one's life expectancy. The sooner the diabetes is diagnosed, the sooner the person learns to adapt, the sooner his lifestyles get better, the prognosis of living longer gets better. So going to the next slide. So now I'm going to talk briefly about how research and science have taken roles in shaping diabetes since it was identified in early 1500 BC. So diabetes discovery have dated way back. In 600 BC, physicians recorded that ants were attracted to sugar patients' urine. During the Middle Age, doctors used urine flavored chart, the one you can see, the circular chart, that's called the urine flavored chart. So they used this chart to diagnose medical conditions. The one disease that they diagnosed correctly was diabetes because of the sweet taste of the patient's urine. And then in 1921, there was a revolutionary invention of insulin discovered by Sir Frederick at our own University of Toronto. So before 1921, it was unexceptional for people with type 1 diabetes to live more than a year or two. And until today, this is the only effective treatment for people with type 1 diabetes. Then in 1964, a company called the Ames used the urine test, refined it, and by 1970, they came up with the first glucometer. The picture you can see with the square glucometer. So that's the first glucometer they invented. And then it took another decade for it to before it became an easy to use home glucometers. And by 21st century, we now have the needleless glucometer available. Isn't it amazing to see how much science and research have evolved over time? So getting to the key question of today's topic, does diabetes reduce life expectancy? What does research have to say about it? So learning the life expectancy has been an area of research interest since long time. So this paper I quoted here, it dates back to 1977. So the authors here tried to plot a life expectancy bar graph of diabetic patients age-wise from before insulin era and after insulin era. So I'll show you the graph. So this is how the graph look like. The bar graphs you can see, the black bars are before the insulin era and the gray bars are after the discovery. You can see how life expectancy have increased with the discovery of insulin. However, this increase is much greater in younger age compared to those 50 and above. So I just want to pause here and ask my audience, why do you think of this variation? If anybody, feel free to jump and answer me. Like, why do you think the bar has been so different for age groups?
Sorry, Nabila, I did not get your question. What was the
Oh,
question?
okay, I'll repeat that. So the question is, the bars in this graph, the black bars are the before insulin discovery. The life expectancy before insulin discovery for younger age was 1.3, 2.6. Then for age 30 and 50. And then after insulin discovery, the gray bars have increased the life expectancy. But you can see for younger age, like at age 10, the bars are so high, the expectancy have increased like triple or fourth time folds. But in age 50, it hasn't increased much. So do you know why is this happening?
Uh, Maybe the younger population, they died because of the complications, and the older population, they might have some kind of like, what do you say, immunity against of it.
That's a nice
I
answer,
think
but I won't say it's the right
Don't
one.
answer. So Lam Douglas would like to say something.
I have some people raised hands.
Uh, Douglas, you have to unmute, please. Douglas, you have to unmute, please. Okay, we can go to the Elahe. Elahe.
Hello, everybody. Thank you, Nabila, for the very interesting topic. I think that at the age 10, most of the diabetes is type 1. Because of that, maybe the insulin is the most impact for the life expectancy. Is my opinion. Thank you.
Absolutely right, Ilahi. That's the right answer.
Thank you.
Because
Leon Paul would like to add something. Leon Paul. Give other people chance here.
Hi, thank you. Lion Paul from Hudsonville.
Hello.
Yes, Paul, go ahead.
Very interesting topic and conversation. I think also as maybe more people are getting educated on this diabetes knowledge, and I think there's more awareness, so the life expectancy is improving. Thank you.
Thank you, Paul. But we are talking here about like 19, like you can see in the graph, it's about 1897 and the eras of early 90s. So that time the education was not much. But like as Elahi said, that was a very right answer. That type 1 diabetes occurs in younger patients, and it is an autoimmune disorder where they do not have insulin producing cells. The insulin producing cells are the pancreatic beta cells. They're destroyed by the immune system. So the body needs external insulin to survive. So previously, before insulin discovery, children used to basically die within 1 to 2 months. And after insulin discovery, that was when the children started having a greater life expectancy. But in type 2 diabetes, which occurs in old age, they don't actually require insulin. It is not insulin dependent. There are other factors that can control the diabetes in the older age. So this was the actual reason why before insulin era, the graph was so low, and after insulin era, the life expectancy have increased so much. And absolutely today we have this answer because back then there was no answer. People knew there was diabetes, but they didn't know there were 2 types of diabetes. So obviously this was a curiosity, like how it generated our curiosity that why the graph have increased so much. So back then there was this curiosity, why this graph is so much. So just to get over this curiosity, another great researcher named Sir Harold Hemsworth in 1936, he developed an experiment which helped us to distinguish the 2 types of diabetic patient. So I'll not get more details like what was his experiment. I have his paper in the reference if anybody wants to go through. But just the results of his experiments found that the type 1 and type 2 diabetes, like he didn't name the type 1, type 2, but he named them as insulin sensitive type, like you can see in the summary, the highlighted insulin sensitive type and the other insulin insensitive type. And he said that there is an unknown factor, which he didn't know at that time, that sensitizes the body to insulin. So that was an interesting discovery as well. And till today, we distinguish these 2 forms of diabetes. So now I would like to go to the next question. Does people with type 1 diabetes have shorter life expectancy? So while major advances in treatments of type 1 diabetes have occurred in past 3 decades, type 1 diabetes has historically been associated with significantly reducing life expectancy. Thus, to examine the life expectancy in the people with or without type 1 diabetes, Scotland researchers did a 3-year cohort study and reported that life expectancy at age of 20 years is approximately 11 years less 11 years less for men and 13 less for women compared to the general population. So with general population, and this shows that even the patient with type 1 diabetes who still had good um, there is no cure. Sorry, I'm so sorry. Um, I'm sorry. Yeah. So, oh yes. So, as I was saying, in 3 years cohort study and reported the life expectancy at age 20 years is approximately 11 years less than man and 13 years less for women compared to the general population. This study also showed that even patients with type 1 diabetes who still had good kidney function had reduced life expectancy. So this was a study of the this was the Scottish study which I highlighted. So now that I want to share with you two more studies that in a separate study at an average of 27 years of follow-up with patients of type 1 diabetes, 6.5 years of initial intensive diabetes therapy was associated with modestly increase in life expectancy and all the causes compared to the conventional therapy. So they said that there was more like intensive treatment was better than the conventional. So intensive insulin therapy, they meant is like a tight blood sugar control, closely monitoring blood sugar, using multiple doses of insulin and keeping track of food and exercise. And the conventional type is basically injecting the long-acting insulin that works for at least a day. And the second study, which I highlighted here, is why it says that while the longevity of those type 1 diabetes has improved considerably over the past centuries, this patient remains with the reduced life expectancy compared to non-diabetic population. Nevertheless, a subgroup of these individuals may survive into older age despite their diabetes. Certain clinical and biochemical features can identify these people. This understanding may provide clinicians with further evidence that correction of modifying risk factors like glycemic control, blood sugar, avoidance of excessive weight gain, and lipid control is vital in ensuring the ongoing longevity of patients with type 1 diabetes. So these are some of the studies I highlighted about life expectancy in type 1. So coming to the next question, does type 2 diabetes shorten your life expectancy? Well, research finds that there is substantial variation in life expectancy among people with type 2 diabetes, depending on their level of commonly measured risk factors such as HbA1C and as well as the duration of diabetes across different age groups. And the estimated age-specific life expectancy for men with type 2 diabetes varies between 13 years to 21.1 years. So the range of estimated life expectancy is wide, depending on the person's age, lifestyle factors, and treatment. For example, if a person does not manage the glucose level effectively, who smokes, who does not exercise, likely to have a shorter life expectancy than a person with healthful, active lifestyle who does not smoke and maintain the stable blood glucose. So it is very important that we make healthful choices, lifestyle choices to go a long way and live longer. So yes, there is no cure. Absolutely, there is no cure, but scientists are working very hard to make a groundbreaking invention so we can conquer diabetes someday. Some of the most recent advances of diabetes care includes innovation towards bionic pancreas, or also known as artificial pancreas. Then there is stem cell therapy, then intervention targeting intestinal microbe and then there's development of artificial pancreas device system, discovery of druggable insulin inhibitor called Inceptor. So if anybody is curious to know what is the artificial pancreas device system, I'll just shortly say that it does not involve any tissue or organ. It is a kind of a continuous glucose monitoring system that works through a tiny sensor which is inserted into your skin, usually in your belly or arm. And the sensor measures your intestinal glucose level, which is the glucose found in the fluid between the cell. And the sensor then tests the glucose every minute and it wirelessly sends information to the monitor. So with science as its speed in development, I'm very hopeful. Diabetes will be curable and we won't have to worry losing life to it someday. So thank you for your time and patience. Please feel free to reach out to me. That's my email address given there, and I have my references for you. Thank you again.
Thank you, Lounge President Dr. Nabila. I'm so proud of you. Those who just joined, or first time those joined, I can tell you that Toronto Global Doctors Lions Club and Scarborough Global Doctors Lions Club is combination of the immigrant health professionals from around 30 to 40 countries in the world. These are the young professionals came to Canada and they just engage with community services with us, and we started last July to start to promote our awareness in diabetes, one of the greatest cause of Lion International. And Nabila is one of the champion to organize these things behind the scene. So I really congratulate Nabila and my team, Dr. Mithila, Dr. Agafaya, and Mohammed, and others. So let's give a big applause to Nabila for her excellent presentation. And going forward, I would like to ask you, you can write in the chat box, who is the guy, Canadian proud of the invent the insulin in 1921? So I don't want you to be stressed. So if you don't know, it's okay because it's difficult to remember. His name is, he's from EFT, obviously. Yes, Governor Jeffrey rightly mentioned, Frederick G. Banting, and his colleague Charles and John McRoy of EFT. So we have a proud history of Canadian. So 1921, they start this totally 100 years of kind of Lionism in Canada, 100 years, and insulins came in 100 years ago. And recently, EFT also got a huge grant to express these things, to forward the diabetic research. So, and Nabila also working with studying at EFT and with my research team to do these things. So all good things. And you can see in the $100 bill, we have also these things. You can see it, 100 years of insulin. So we have many things to be proud of, but we need to disseminate our information towards our general population. That is why Scarborough Global Doctors Lions Club and Toronto Global Doctors Lions Club, in collaboration with the district governor support, we launched this initiative to learn from each other experience and share our new knowledge so that we will be we're better informed how we can control our diabetes or makes our life prolonged. Now I would like to, I can see our district governor, Leon Thibault, is here, and Apache District Governor Leon Jeffrey is here. If I would like to ask Governor to say his remarks. Governor, are you there? I saw some. Governor Thibault? Okay, maybe we lost. So I can see clearly our PDG Governor Jeff always with us to inspire us. So Governor Jeff, please.
As usual, the content is exceptional. Unfortunately, I came from another Zoom meeting to join, so I didn't catch the first portion. I must comment on the wallpaper that's so prominent here amongst your members. Congratulations. It's good to see that you're fully supported. And that's a good thing. I'm just going to put a plug in here to say whether you're a Lion or not, no matter where you are in the world, you're welcome to come to our convention. I just shared in my last call the content for our Saturday session. For those of you who are Lions, our convention is somewhat like a micro version of the Canada-USA Leadership Forum. It's more than just the basic business of running the district, because I feel, to involve all of you in collaboration and discussion about what we are doing and what we can do going forward. We have some 88 clubs in our district, if you count Lions, Leos, and Lioness Club. And together, they each bring different perspectives and different experience to what we are. We have a massive population in the Greater Toronto Hamilton area. call it an untapped resource. We have some guests coming to our convention. Daniel Elkins, who I've talked about in past conventions, will be a guest through the entire convention, doing 2 sessions talking about how we can grow, involve younger people, and make our association stronger. So I'll just put the plug in there. The distribution of the link to that has been put out by our cabinet secretary and Eli Galindo, who does the news blasts. If you don't have it, contact either Dr. Shafi or myself. I'm sure we'll be pleased to give you the link so you can register.
Thank you, Governor. It's wonderful because the Lions Convention is one of our prestigious event and learning event, and also get together event, or also celebrate our success, and also elect our incoming leaders for govern and lead the district. So I encourage all of you to join. That is very impressive one. Thank you, Governor Jeffrey, for your information.
You're
I'd
welcome.
like to go to my friend Land Region Chair, past Region Chair Rick Mellon. You have any questions? Any comment? I saw you were here from that other meeting.
Thank you very much, Dr. Shafi. It's always a pleasure to join your sessions. I feel old for some reason. Everybody looks so young and so happy, which says a lot. The young folks here, that's the future of our organization, but in a different way, because they're learning service at the right age. So now they're at a point where they can make that a part of their lifestyle. The giving, it ties in with the healthcare background that a lot share, that giving of oneself and serving others and doing for others, and it leads hand in hand to making the community a better place. And I commend you all. Again, another tremendous session. My congratulations to the presenter tonight, who did a great job. This, I think, is the 4th or 5th one I've been in on. They've all been just excellent, and I commend you for it, and looking forward to the next one already. Thank you very much, and we'll look forward to seeing you all at the convention.
Thank you, Rick, for all the time your inspiration and support. All the events we are doing. I'm looking forward to the next wonderful events. So I can see Mel, who is also one of the champion, always encouraging us to go, always move forward with this event. Mel, you have anything to say?
Oh, I think it's all been said, but it has been a great presentation tonight. I enjoyed it very much, and I really clap my hands for the speakers, because they both did a very great job. Thank you very much.
Excellent, Mel. So now I would like to introduce all of you. We have a guest today from District A4, Governor Jen. I would like to ask you if you have any comment, concern, or any question. Go ahead, Governor Jen.
I think it was a beautiful program. I quite enjoyed it. I don't know what to do with Nabila's presentation about 13 and a half to 21 and a half years, because I was diagnosed in 1988. I only went on insulin in 2013. That's 25 years later. And then I'm only at a 10 units per night. So
you'll be 141 years, no problem.
Yeah, I passed that a bit, so I'm kind of worried about when my time is going to be up.
Another 41 years at least.
Well, maybe.
At least.
But I really enjoyed it, and I think it's a good thing to have, and I'm hoping to join you again if I'm invited.
Of course, we will invite you, and I would like to invite my colleague, Marlene, one of the diabetic chair in A4. Marlene, you are there?
Thank you, Dr. Shafi.
Keep it short.
I will. what I wanted to say to everyone this evening, we are honored. We're having our District A4 virtual convention on April the 17th and 18th, and we're honored to have Dr. Shaffi. He will be participating in our diabetes training session. Isn't that wonderful? And so we're really looking forward to that. And this evening, I want to thank the speakers. It was most interesting. My husband was a diabetic for 30 years. And I am sad to say the things that were brought up this evening, I could relate because my late husband did not take care of himself. And this is what the life expectancy program is about. If you do what you should do to take care of yourself, you can live quite a normal life. But my late husband suffered from the things that you did talk about, but it was his lack of caring. And thank you very much. The speakings were wonderful. And thank you, Dr. Shaffi.
Thank you, Marlene.
I'm looking forward to seeing you.
Yeah, thank you so much. This is all about Lounge is about coming together. This is important. When we come together, we must do something. And I thank Governor Thibault to connect with you, and then we get connected, and I invite you to join to see how we're doing and how we can collaborate each other. And I'm glad you invite the Governor Jane, and he also going to have a big leading role in MDA for diabetics. Hopefully we'll work together more closely. Thank you.
Can I ask another question?
Please.
I was always told, and I do it, that as a diabetic, I should never walk barefoot. Is that true?
Yeah.
Nabila, you would like to answer?
That's true, actually, because diabetic person has always immunocompromised. They have very high chance of taking up infections. So walking barefoot has high chance of getting, if we have any cracks, especially in foods we have cracks, you can get infected from there. And diabetic foot is a very common condition in diabetic person. So yeah, it is always recommended not to walk barefoot at least.
Thank you.
Thank you.
And Nabila is nicely explained. This is the thing. One of the problem is amputation. You see, most of the people, they lost their legs all the time due to the infection because it's uncontrollable in some point. So there's a prevention reason you need to be careful about that. Any other discussion? Yeah, Dr. Nahid, go ahead, please. Go ahead. Unmute, please, yourself.
Just wanted to, hi there. Thank you for taking my this thing. I just wanted to add for Nabila, because in diabetes, your sensation is lost early and you don't feel when you're infected and all that, when you get a cut, when you get, because you lose those.
I said TV off.
So that's the reason you get infection, and that's why you're asked not to wear barefoot. Thank you for giving me the opportunity to answer.
Yeah, we have a surgeon here, Dr. Maureen. So she can also share how common it is, the diabetic amputation in the operation theater all the time. Maureen, can you have any experience?
Yes, sir. As I was, thank you for giving me the chance. As also others explaining that there is a high chance of peripheral neuropathy where patient doesn't understand when they get hurt, and the infection increases and causes like ultimately necrosis of the part of the leg got dead, like especially the fingers. In that case, they have to go for amputation, and also it causes vascular disease. That's why the blood supply reduces. So it's really common, but now as there is many foot clinics in Canada, the prevalence is decreasing. Thank you.
That is why in Canada, we need to think about the prevention. Canada has not kept up the advantage of made in diabetes prevention over the last 2 decades. So we need to think about it. Only 4,000 people is get taken care of by the seats space. They have a protection mechanism. They have a YMCA 200 sites. They're offering the Certified Diabetes Prevention Program. And the Center for Medicine and Medical, they also 950 prevention clinics all over the US. So we need to build awareness and learn, and we say where there is a need, there is a learn. So is a Lions Club, that's why is a right fit to come to the community to help support this initiative. And we as a district and as a all Lions Canada, we have a role to play. And awareness building is one of the easiest way and most safest way and accessible accomplishment we can do. We can control, we can live longer. Even today slogan you said, live longer with the diabetes. Diabetes is a discipline disease. If you follow the rules, if you like public health now saying, wash your hand, wear the mask, and don't stay within 2 meters, then you can save the COVID-19. Same thing, you just watch your food, walk every day, to exercise, limit your intakes based on your needs, then maybe you will be good. There is no limit, there is no way, no magic number, 20 years you will survive. You will survive maybe more because your life is disciplined. Okay. Any other questions from the floor?
So this is Nur Nabi, sir.
No, go ahead. No, go ahead.
Yeah, thank you. So there's a statistics I already put in the chat box, so you can see how it was increasing in last decades. The lower limb importation due to diabetic, like angiopathy or other things. So it was really alarming. I mean, you see the statistics, it was upgrowing. It's in the chat box. You see the statistics.
Great.
Thank you,
Dr.
sir.
Fahim, you have any new information we can share with us? He's our live human dictionary.
Thank you, sir. Hello, everyone, and so nice to learn from all of you. Actually, diabetes is like nowadays we call diabetes a cardiovascular disease because it affects the heart and the cardiovascular system more. So people all over the globe are nowadays calling it like not a systemic or metabolic disease, more like a cardiovascular disease. And another thing I'd like to share is that the diabetes patients, like 10 or 20 years ago in our country, we felt that whenever a diagnosis was made, people felt that we are dead, we are wrong, we are so much devastated. But nowadays, diabetes, we have to think about like it's a common thing. Every people might get diabetes, no worries. Diabetes, if you are diagnosed, you think yourself as it's a lifestyle modification approach. When you are diagnosed with diabetes, you think that, oh, nothing. Maybe this is a chance for me to build my lifestyle in a very positive way. And all of us like should learn that how to build our life in a positive and a smooth way. Yeah, I think it's a very learning approach for me. Thank you so much.
I have a question.
Yeah, Maria, please go ahead.
Yeah. All right, then. Annabella Tasman, one of the items was the stem cell research. And I remember reading years ago that and this is that for the type 1 diabetes, that and it's family. That's one of the criteria is family. And the stem cells, years ago, I heard that when a baby is born, they take the stem cells and they freeze them for other members of the family should they come up with a particular disease. And I was wondering, is it the same thing for diabetes?
Yeah, absolutely. They are like researchers are working because when a baby is born, the parents have the chance to save the cord blood for the stem cells.
Yes.
So you have the choice for that because researchers are like working on that, if they can use the stem cells to recover diabetes, to get the the medicine for diabetes. So it is working on that. Researchers are working, but still we haven't reached there yet.
Right. Now tell me something. The other thing that's years ago, they came to Canada from the States, read this stem cell because they didn't allow it or do operations or research or whatever it was. Is it still like that today or is it changed?
No, it is changing. It is changing.
It is changing, but it hasn't changed completely, that both the Americans and the Canadians are more into the research and doing these things.
Absolutely, because we have ethical considerations on every research we do. So
right.
keeping that in mind, we are going ahead.
So that brings a lot of famous doctors to Canada. I think that's wonderful. Yes, and this the stem cells for one thing. Yes.
Yeah.
Thank you for letting us know this. Thank you.
Thank you. Excellent. So is there anybody, anything would like to share? Floor is open now.
Thank you so much, Dr. Shafi, for this excellent presentation. Everybody was so good. I just wanted to add one thing that we have observed tight glycemic control with the weight reduction really impact on the diabetes and the life expectancy and development of the complications. So weight reduction is a vital component, has shown as a vital component in reduction. Thank you.
Wonderful. Wonderful. Thank you. So there is a 5 screen, so I may lose track. I think I would like to ask Munni to say about her experience. Also, she can also invite you something which also can healing dance. Munni, go ahead.
Yeah, thank you very much. And every time my knowledge increases, and I get so happy in doing what I'm doing. And I would like to offer this to all of you. Actually, many of my students are here, and some of them are 80, 60, they're all seniors. And I have been doing this therapeutic healing dance. And I can tell you, if you take Dr. Shafi, if you talk to them, you will hear how the lifestyle and a lifestyle is and how good they are. So I offer all of you, please join me. It's free. I'm going to do it free for you. Just join me.
Yes.
This is a healing dance. And I have as far as Parkinson person also. So they are, in fact, Meldrita, are you there? Meldrita.
Go ahead.
Meldrita, can you say a few words? She's 80 plus.
Anybody here from the healing dance group?
Yeah, there are many. Meldrita, say what?
Go ahead.
Very short.
Okay, I am 82 years old.
Oh no.
And I have had 3 hip operations total. And I find Muni's dance is really helping me to be more mobile and to alleviate any pain that I feel sometimes. So I have to thank her for that.
Oh, great. I have Nazneen. Thank you, Meldrita. Nazneen,
you're welcome.
To say a few words. Nazneen.
Yes.
One of them.
Hello. I'm Lion Nazneen, and yes, I actually have been diagnosed with diabetic not too long ago. And I had problems with my legs, and I didn't realize why it was happening. So now I know why it was happening, and the therapeutic dance actually helped me so much that I actually got to buy a new pair of boots after I joined her. Otherwise, I couldn't. I was always in sneakers, and yeah, it has actually taken away a lot of my pain from my hips and my legs, especially my heels. Yeah.
So, sorry. Yeah, thanks, Nazneen. So these, you will hear each one of them saying, just, Stephanie, come on, say a few words, quick. I've got the whole gang here.
No problem.
Stephanie, are you there?
Yes, I'm here listening.
Okay, yeah. Say a few.
I've been with Muni for about 6 years, and really supporting my health through exercise. And it's the joy also of exercising that makes you want to exercise more. So any of us putting in more exercise because of joy and bringing our mind, body, spirit into it helps the healing as well. So Muni is a great inspiration to us. Thank you.
Excellent. So it means that you all need to think about physical activities or somehow, some way, then it will be great. We have a physiotherapist here, Dr. Abhishek. You can say something, how you manage your patients.
Thank you so much, Dr. Shafi. So yeah, I was just listening carefully. So all the points have been absolutely correctly posted. So weight reduction is one important point. Managing foot is another very common point, because the diabetic neuropathy does take your sensations away. and that's why it is recommended to do daily inspections using long handled mirror. Be careful that if there is any abrasions, make sure you inspect it thoroughly. It's always recommended that we use normal temperature, lukewarm water, not extremes, not hot, not cold, always pat dry, and like in between the toes, just make sure it is dry, and take care of your feet as well. So it's very important. It is an overall lifestyle disorder, but taking a positive approach could absolutely change it 180 degrees. Thank you.
Excellent. Now I'd like to introduce one of our champion who is expert in retinoblastoma. So this time I will introduce with our Governor Jeffrey that we got one presenter for diabetic retinoblastoma for the convention. Anuradha, can you talk about your brief presentation, what it will look like? We are preparing for the convention. Dr. Anuradha? Sorry to put you in the spot.
But you did.
Anuradha, are you there? Maybe we lost her. Okay. So Governor came in Ken. You would like to say anything? Okay.
Dr. Safi?
Yes.
While we're waiting for, I think that your physiotherapist, what he said was great. And one thing I've been doing now for years is every 3 months I go see a chiropodist who takes care of my feet.
Mm-hmm. Yeah. So we have in our group, we have all varieties of doctors, physiotherapists, neurologists, surgeon, medicine specialist, all sorts of things. So we are a complete group to address the diabetic things. Of course, any club, any member, any guest would like to know anything or would like to arrange seminar, just reach out to us and we'll be happy to join you to go through the everything. As you know, we already have a 8th session. We cover childhood diabetes and adult diabetes and pregnancy, amputation, all sorts of things we covered last 8 months. And we'd love to do and continue our effort.
There's so many doctors, I feel like I'm the patient.
No patient. So all we learn together. As our first presenter said, is empowering the patient, is the disease controlled by yourself, but we need a team effort. So doctor, family, and patient all work together for the same goal. It's not only one person can address these things. It's a collaborative effort again. And it's very good team effort actually. Governor Jeffrey, you'd like to say anything? I cannot see our Governor Thibault is here yet.
Oh, he's here, but he's not.
Yeah, maybe he's in the other meeting. Maybe. Governor Thibault, are you there? You'd like to make a closing remark?
Actually, there's one more governor, Governor Ilka.
Yes, Governor Ilka. Governor Ilka. Yeah.
I think Governor Ilka as well.
Okay.
I'll defer to him for now.
Governor Ilka. Governor Ilka, can you unmute? Just.
Governor Ilka, you have to unmute.
Button on the left lower corner of your screen.
I'm back to the business. I just lost short time.
Excellent, good.
Well, that has been very good what I have been hearing now, and mainly because I had 3 years ago when I was in Florida, I get some infection in my foot because then I went to walk a swimming pool without any support my foot. And then it took today almost 3 months to get that infection out. And then it is very important, the diabetes, but they're talking about food problems and I also had my long time diabetes for have been 60 years. In 1988, I had the gangrene in my foot. And I was lucky because good doctors was able to save my foot that time. And since that, I have been very careful with my foot and make sure every time, at least 3 or 4 times a week, I have to inspect my foot and make sure any nails doesn't crash to the other side of the toe, which can cause infection very easy, your foot. And it has been, doctors have been very good information that meetings what we have now. And that how we learn so many things, what people has been have. And then very interesting is that exactly that the life, what's inspection, how much longer life. And then Dr. Sari told me once usually what they say it is in 11% with the type 2 diabetes if you take care. And I have been done very well. I was very young when I get the diabetes. I'm now 73. And then thanks really in all the support that I have been get. And then Dr. Sari has been very good helping me that. And then Canadian Diabetes, USA Diabetes Society has been very good information over there. And I have been trying very often some natural things that have been learned from India, like kombucha tea, which give me out of the high blood pressure pill since the 1988. And now I have been using apple cider vinegar. And then it has been helping my blood pressure down now. Now it's a little bit too low now. It is only 150. What maybe have to get up a little bit. But it is a big issue always that high blood pressure with the diabetes people. And if you get the cholesterol right, then going to every 4 months get your blood test and all that done, and that can keep the monitoring. And thanks again, Dr. Sapi, that was very interesting, even what you have been listening again. Now let's continue in the same way, and we can help.
Yep.
I can bring one people who has now type 2 diabetes, and he doesn't understand. He's only 45 years old, and he doesn't really take care by himself. He has been having complications already. And I'd like to ask him to join next meeting, and
yes,
he can
4th week of April
information.
after the convention.
Okay, great.
Then. Thank you.
Thanks
Governor.
again.
And I can see Dr. Anuradha before going to Governor. Anuradha raised her hand. Anuradha, go ahead.
Thank you, Dr. Shafi, and sorry I was unavailable at that time. I'm sorry for that. And it was a wonderful session. And as told by the speakers, diabetes is a burning issue. And in the next upcoming session, with great permission from you, I'll be highlighting the effects of diabetes on the eye, because it's a leading cause of blindness, and it's a very much preventable. So I'm looking forward to get an opportunity to share my thoughts on that in the upcoming sessions.
Yes, thank you. Thank you. Okay, so Governor Jeffrey, you have one more presenter ready for the conventions. It will be very enriched presentation, so many angles. Thank you.
Please send me the details. I'm finalizing the actual program right now.
Yes, I will send as soon as possible. Governor Thibault.
Yes, did we hear from Governor Kai Min Kai?
Not yet. I don't know, he is there or he is going for a dinner or something.
Okay. Well, let me jump in right here then. It's always great to attend.
Governor, to report you, at one point we have a 91 participant. So
91.
So
wow,
because of 2-3 meetings, still we are close to the 100.
Yes. And I'm pleased to see my fellow Governor Jean Lauzier from District A4 and his diabetes chairperson, Lion Marilyn Southall. Glad to have you. Of course, chairperson Lion Dr. Shafi, past and present district officers. I want to also recognize we have some cabinet officers still online. We have Governor Jeffrey, Governor Ilka, and Cisco, Governor Kai Min Kai, and we have Zone Chair Lion Dr. Mohammed Biswas, of course, all the members of the the Toronto Global Doctors Lions Club and the Scarborough Global Doctors Lions Club. And who knows, I think I saw somebody from the Toronto Doctors Lions Club, like 3 Doctors Lions Clubs here, over 100 doctors on the same call. That's so amazing. I also see Zone Chair, Past Region Chair Lion Rick Malaw. I see, we have several clubs still represented. I see Lion President Teresa from the Beaches Lions Club. We have Lion President Money, Ambo from the Toronto Beyond Difference Lions Club. We see Lion Angia Saul from the Tisseltown New Era and several of our members as well. Good to have you. We have Lion Chris Johnny from my own home club, Tisseltown Lions Club. We have a Leo, actually a campus lion, Lion Mufrat, and just a lot of doctors. Always, I feel safe in a seminar like this. You could get advice on any medical issue. Hope not that we want to get sick, but thank you again for the opportunity to be able to, from the comfort of our own homes, get expert consultation, expert advice from subject matter experts from around the world, because these are internationally trained medical professionals. And as usual, I'm sure there's 1 or 2 persons who logged in from outside of Canada, like Dr. Shafi. I'm sure, because you always bring them in as well.
Yes.
So thank you again for this forum. And we always look forward to it. I know I missed the first part of it because I had other duties, district duties at a region, zone, district governors advisory meeting. But like Dr. Shafi always have these sessions recorded. So I will go to the recording and avail myself of all the information, because guess what? We could never stop learning. Learning is continuous. And the more we know, the better we are able to maintain our health. So thanks again for all that you do, and hope to see you all again next month and in the future as we continue having these sessions, because as I said at the beginning, way back in July, Dr. Shafi was the first district committee chair to bring an agenda and a calendar list of dates to have all of these sessions. And every single session has been well attended, and every single presentation has been phenomenal. So thank you for the presenters. And I know some of them will be at our convention as well. So guess what? All of you on this call, you're invited to our convention as well to continue learning. I think I know we usually be on this call until like 11 o'clock. So I'm going to give other persons a chance to speak. But just want to thank everybody for giving their time. And usually there's fun and food as well, but the food is in your fridge. And the drinks are in your bar. So you can't complain about the menu this time. Thank you.
Lion Tebow.
Yes, Governor.
Maybe we could surprise our districts. We have a convention at the same time. Maybe we could switch. You over here, me over there.
I know. I plan to visit yours, yes.
You're welcome at ours.
And have you present my speech?
Yeah, Governor Timo, thank you so much. All your do and encouragement at the day one, and also your kind connection with Marlene. That's why today Governor Jane is here. It's all about connection, connecting the dots. You are champion to do that. I encourage, and we have participated. Governor, you will be happy to know that in election day, I'm going to have a talk about the diabetes in the district A4. So that is when Marlene reached out to me, I said, no way, service and teaching is first priority. Election is second. So even though I am the candidate, but I will go for the diabetic seminar awareness training with A4 in convention. Thank you, Governor Jen.
And of course, you have the incoming MDA.
Chair.
Did you tell them, Governor?
Yes.
Okay, good.
Yes, I did, yes.
So you have the incoming MDA diabetes chair. So we're in good company.
We have a relationship we are building now that we can do actually many good things together. Yeah. Thank you, Maria, for showing the T-shirt.
Yes,
we all
Avery's
campaign.
cancer research. That's right, the T-shirt. Thank you.
Last month we campaign and we raise fund. Lion Munni donate $1,000. Our club donate also $1,000 in the same meeting. Can you imagine? So
Thanks
we
again,
all
Lion
promoting
Munni.
cancer.
But they're quality cotton. They're beautiful.
Yep.
And the design on it, and the design was done by the child herself. It was just absolutely wonderful, just wonderful. And I think they're still available.
Yes,
I think they're still
I'm
available.
glad that Maria, you got it. So
Yes.
very quickly.
So
Excellent.
yeah, good. Thank
Again,
you.
yeah. Anything, Governor Jane, you'd like to add last word before we closing? Anyone?
I enjoyed it.
Thank you. It's already more than 2 hours. Time flies very fast. Now I would like to ask Mohammed to thank our guest formally.
Thank you, Dr. Shafi. Can everybody hear me?
Yes.
Dear District Governor, past District Governor, District and Club officers, guest speakers, fellow Lions, and your family members, good evening. On behalf of Dr. Shafi Bhuyan, PhD, MJF, PRC, District A-711 Chair for Diabetes, Campus Lions, and International Youth Exchange Program, and candidate for second Vice District Governor position for the year 2021-2022, and also on behalf of his joint organizer team of Toronto Global Doctors Lions Club and Scarborough Global Doctors Lions Club, I would like to thank all of you for joining us today. It is you and your participation and contribution of time, treasure, and commitment, which creates this evening of 8th Diabetes Awareness online session more memorable. As you might know that Pearl Buck mentioned, if you want to understand today, you have to search yesterday. We Lions, our past is very strong. We have been started our journey with courage, strength, activity, and loyalty. Loyalty to a friend, to a principle, to a duty, and last but not least, loyalty to a trust. Our objective is focused on global affairs, national problems, needs of local communities, and the welfare of individuals. Our code of ethics tells us how we should live. Our slogan is liberty, intelligence, and nation's safety. We are loving individuals offering needed service. Our motto is we serve together through diversity, integrity, and with kindness. We are proud of our past and confident for the future. It's our time now to learn, discover, act, and celebrate. Fellow Lions, our visionary leader, Dr. Shafi Bhuyan, always encourages us to stay together, collaborate each other, and help our communities through knowledge sharing, service activities, and ethical leadership. Tonight's session is one of his great continuous initiatives to facilitate We Lion, our capacity building, and serve for greater cause. So on behalf of District A-711, I would like to give a special thanks to Dr. Shafi Bhuyan and the guest speakers, Dr. Yasmin, Dr. Iman, Dr. Nabila, for their informative and wonderful presentation. I would also like to thank our organizer team, especially Dr. Agafaya, Dr. Mithila, Dr. Nabila, and last but not least, Dr. Min, for their continuous hard work to make this event happen. Finally, we are very grateful to our district leaders for your kind encouragement and tremendous support to make our year-long monthly diabetes awareness online sessions successful. I hope all of you have enjoyed and learned a lot from tonight's discussion. Our club officers and members are always committed to continue our services for any need in our district. Having said that, we would like to encourage all of you here tonight to join our district convention scheduled on April 16th to 18th, 2021. And please cast your valuable vote to elect our next second Vice District Governor for the year 2021-2022. Thanks again, everyone, for your great participation tonight and for everything we have done and will do together for our Lionism. Together we are stronger and always moving forward. Please stay safe and healthy. Thank you and have a good night.
Thank you. Thank you. Wonderful.
Thank you, Mohammed. Well said.
Wonderful.
I have nothing to add. I just want to request all of you, please join our convention and we'll work together. We'll continue this kind of learning session, leadership development, giving the opportunity to learn and grow together. And as you know, continuous learning is important. When you stop learning, you're dead actually. So we need to always moving with learning each day, every day. So I think you all need to go now for your dinner or you're with family. Stay safe and healthy and hopefully see you in the convention. Thank you.